Okay, great. So thank you very much. I think now the systems are in place and I'm able to see the presentation as well as have a view of whether it's working or not. So I understand from Riku ma'am that we are all eager and doing our post-graduation and we all are very much excited to be a part of this insurance industry and very excited to know more about health insurance. So that is the key, I'll say, background with which we'll be discussing further in sessions today. So we'll be having two sessions, hopefully within time, whatever time we have. We'll try to understand what are the diseases, how do we manage the commonly occurring diseases. Also, we will touch down on certain high value claims management part. And then we'll also have a session on what is the role of a TPA and how TPA adds value to the insurance industry. So, as we proceed further, my humble request to all of you, if you are in a position to have your videos on, you may please keep them on. And feel free to stop me any moment to ask any kind of a question which can come out in your mind from any direction. So even if you feel okay, there is one word and that one word takes you to another word which was heard maybe 2 years ago and you want it to be clarified, feel free to ask it. This session, I want it to be an interactive session. So by the end of this session, how much marks you get in your exams is not going to be in my control. But I can assure that all of you will know what are diseases and how to manage those diseases from claims perspective. What happens, what needs to be done, and what ideally can be done in future as well. That is assurance number one. Assurance number two, you will understand what TPAs mean, and if tomorrow you were to join any TPAs, you would be in a position to join directly at a senior level because you would have understood what the functionings are. So with this background, let us start our discussions further. So when we want to understand about diseases, what is important is why do you want to understand about diseases when you are going to be joining an insurance industry? The reason behind that is the role is going to be about adjudication. So a contract has been established between an insured person and the insurance company, and based on that contract, the further claims, if any, which are coming from the insured are to be managed, and that is what we at MD India have been doing over the last 2 decades and so many other TPAs and insurance companies. So to understand it further, we first need to understand what is adjudication. So basically, adjudication means, in a very simple language, adding judgment. So you are adding your judgment whether what is being asked is proper, is it reasonable, is it fair, and is it within the terms and conditions of the contract which has been established between the insured and the insurer. So anyone who is adding this judgment is an adjudicator, and that is the prime responsibility. And since all these claims relate to diseases, relate to hospitalization, relate to ailments, it is important that we understand what these diseases are, what these ailments are. And if we have this basic understanding, then we are in a position to manage all these commonly occurring diseases, commonly occurring claims by adding real value, not only judgment. We also need to add value, and then the further success comes automatically. So before we proceed further, just want to share certain case study analysis. So insurance companies as well as the reinsurers and nowadays standalone auditors, like we are having a standalone audit vertical, as you would have seen in my introduction. With promotion, it's now Vice President Infographics, Audits and Analytics. So audits is a paramount work. So one of those case study reports is something which I am highlighting here before we go into why we are going into this deep diving towards diseases. So what does audit findings say? The claims have been paid for higher number of days than actual days of hospitalization. Keep it at the background, because when we are understanding these diseases, we will have to understand what is hospitalization, what is days of hospitalization, and what should have been ideal days of hospitalization. So this first audit finding is the introduction for us to go ahead and learn today about these three aspects which we'll be doing. Second finding was claims have been paid despite pre-post hospitalization or operative photographs indicating otherwise. So what does it mean? Ideally, whenever you are having any claims intimations or any cashless requests, we are sending investigators to the hospitals so that they are able to go there, they take the patient's photographs, and for certain government schemes, the hospital themselves are supposed to be taking photographs and sharing for the claims purpose. So these photographs are indicative of whether a treatment has happened, a surgery has happened, because you will be seeing the relevant scar marks of relevant location, of relevant depth, size, shape. So if they are absent, it means the surgery, the treatment has not happened. So we found that it has happened. So what we are going to study from this is diseases where surgeries are done, what needs to be understood in surgeries, pre-surgery, post-surgery, both levels. One of the third audit finding was stable patients admitted in ICU to inflate package rates. Now this is a human nature. We are all humans. And fortunately or unfortunately, we are all here because we are having that inbuilt greed in us. So greed is something which is existing. And based on that greed only the humans work. So there's a moral behavior risk which exists in the business. Hospitals are there for making profit, and profit comes only when the billing is higher, and billing will be higher if the patient is in an ICU as compared to a ward, and that is why you will find such mistakes happening. So now what we are going to understand from this audit finding is how to determine which diseases require ICU, which diseases do not require ICU, which conditions require ICU, after what level the ICU can be down to an HDU and then to a ward. Another audit finding was claims were paid without any query, where all ICP documents were in same handwriting. Fraudulent behavior. So we need to understand how the documentation happens for different diseases. Can the documentation be done in one sitting? Definite answer is no. Because the patient is hospitalized for a certain care plan and a certain care is being given, and the medical legal aspects mandate that the observations, notes, services, whatever is being given has to be noted real time in the medical records. Claims are paid despite investigation reports not signed or stamped by doctor. So what it indirectly is going to help us to understand is which diseases require investigation reports and what ideal investigation reports need to be. Whether all reports need to be signed by doctor, or are there any reports which can be accepted without any signatures. Now please mark this sentence, because this is a question which I am going to be asking you after 15 minutes to understand how many of you are still there in the lecture. So you have to tell me after 15 minutes which kind of a report will be there where doctor's signature will not be required. Another audit finding, claims are prolonged hospitalization without justification. So we need to understand which are those diseases, how much duration of stay is required under certain diseases. Can there be claims without any diagnostic or investigation reports? Because that is another audit errors which we have understood. We have come across claims where the hospital has requested for a cashless for a patient in ICU and discharged directly from ICU, and the TPAs have made those payments. So is it reasonable? Is it ideal Definite answer is no. Because you do not require continuous ICU monitoring. If the patient is reasonably cured, reasonably settled, then he can be moved to a ward. And field investigations are missed. So with this background, let us go into the depth now. So before going into the depth, we also need to understand कि भाई bills क्या होते हैं. What types of bills are there? For diseases to be understood from a claims perspective, we'll have to understand what kinds of bills are there. So these are the different kinds of hospitals which exist in India as of today. So you have got PPN hospitals. You have got hospitals which have been empaneled by the TPAs and the insurance companies, though not part of the PPN. Then you have got hospitals which are empaneled for the mass health insurance or the government schemes. And then you have that subset of hospitals which are not empaneled by any insurance company or TPA. So this is a complete universe, metaverse I will say now, with Facebook declaring that they are now metaverse and not universe. So the metaverse in India for services on healthcare providers consists of these four kinds of providers as of now. And each of them is important when we are going to understand the diseases further. But what is also additionally important here is the 5 different kinds of billing patterns which arise from them. One is very simple, line item wise bill. I touched a patient, patient touched, 1 rupee. IV started, IV infusion given, 1 rupee. So whatever I do, whatever the doctor does, each item is billed separately, line item wise billing. Simple, transparent, easy. Second is procedure wise. So when you say procedure, when we are saying that a person requires a central line placement, so central line placement is going to have many line items. It will have intracat insertion, it will have cleaning of the site, it will have the central line being procured, it will have the intensivist coming in, it will have the insertion happening, then it will have the dressing happening, and then it will have the checking happening. But is it possible to build all those things? कुछ भूल सकते हैं. So then we have intracath placement or central line placement as a single procedure billed at 5 rupees. That is another kind of billings that will come across. Or what we do in the PPN. So PPN was supposed to be preferred provider networks, which unfortunately today is package provider networks. So you have got fixed amounts. Appendectomy 10,000. Hysterectomy 25,000. Procedure wise billing. Third aspect is per diem wise. That is, whatever you do, you will get fixed amount only. So in COVID, we have seen many state governments coming out with circulars stating in this hospital, general ward, pay 4,000 maximum per day, all inclusive cost. So they went on the number of days and they have giving. Or even PMJY like schemes where for medical management you have a per diem wise billing. Then you have fully loaded packages, all inclusive, total knee replacement, 1 lakh rupiah, khatam. You go, you bill, you come out. And then you have open billing where there is no control. If someone is my friend, I will bill him 1 rupee. If someone is my enemy, I will bill him 1,000 rupees. Complete open billing system. And all these are creating the issues when we are going to become adjudicators or when you people will become leadership team in different TPAs and insurance companies, and you will be monitoring the profitability of your health portfolios. At that time, you will be facing all these complications. And further added to those complications are the very difficult scenarios of healthcare position in India. So today in India, you have got only 0.7 beds per 1,000 individuals. While what WHO recommends is 5 per 1,000. And that is why you would have found that in the second wave of COVID-19, There's so much of rush, people crying, fighting, begging. Please give us bed, please give us oxygen, please admit us. And further skewing this data is the ratio of density of beds in cities is 4 times that of rural areas. So if my average is 0.7 beds per thousand in rural areas, what it means is it is 0.19 beds per thousand population, while what is going to be required was 5 per thousand. Such a difficult situation, such a difficult scenario, and all this to manage different diseases, different ailments. And this is something which we are going to be understanding. So, why we are learning all these things? The learning is basically to understand the total claims value, which is definitely a component arising out of the incidence rate and the treatment costs. So, let us understand how these things are being controlled. So, whenever we see any diseases, first let us understand what kind of diseases do come and occur. So, I am stopping the presentation now here before we start again. And I want you to concentrate on what I am saying here right now. So, what is important to remember here is how we control all these aspects. Why different diseases happen, or what we are going to understand from these diseases. So, if you go through the definition of disease, which is available and which you would have also seen, is in simple terminology, it is not being at ease. So, if you are not feeling ease, you are not feeling okay, you are not feeling satisfied, happy, then you are having a disease. And that is what even WHO has defined. WHO has given a very comprehensive definition of health, and anything and everything which is not. Just a second, I have to take one call. हाँ केतन हाँ व्हाट्सएप ही करूँ का ओके ओके कर दो Yes. So we are talking about the WHO definition. I think I am
Excuse me, sir.
yeah, yeah.
Yes, sir, you are muted, sir.
Yeah. Sorry. So we are talking about the WHO definition of health. So what does WHO says? Health is a state of complete. Please underline bold italics. Complete physical, mental, social, spiritual, and economic well-being, and not merely an absence of disease or deformity. So that is comprehensiveness of health, and that is what is being targeted to be achieved by all. And that is what we as insurance companies, we as TPAs are also assuring our clients. We are here to support you if at any time there is a problem you face and you feel that you are not in proper health. So diseases is something which is a state, a condition where you are not at complete physical, mental, spiritual, or social well-being. And this is something which will have to be controlled. So when we talk of diseases, generally what we are talking about is only the physical diseases. But today with the IRDA newer circulars coming in, we also need to be talking about the mental diseases. And as the comprehensiveness increases, as we see in US healthcare, even the economic diseases, social diseases have become a part of insurance services itself. And that is the comprehensiveness which even India is going to witness in near future. So let us restrict our discussion today, since most of you are not medicos and I don't want to bombard you with too much of medical jugglery and jargons. What physical diseases mean? So anything and everything which affects this body, not my anyone's body. I don't want to be diseased. So anything which affects the body of an individual and which prevents it from normal functioning, which is expected from an ideal person of that age and characteristic, is going to be considered as disease. And that is what we all are here to understand. So coming back again, what we are going to be understanding is how to control these different diseases, or what these different diseases stand for. So the physical body structure is something which we'll have to understand first. So you have this head, you have this upper body, trunk, and then you have the extremities. So based on this, your diseases come up. So anything which is affecting superficially is easier to understand, and anything which goes deeper into the different systems of the body becomes additional services to be understood. So from treatment perspective, there are two kinds of treatment protocols are available. One is surgical and the other is conservative. So the differentiation from a medical perspective is, anytime wherever we are going to create any incision and have a break in continuity of the skin and the tissues, then it is labeled as surgery. So the moment I have any break created, any incision created, to give any kind of a treatment, it will not be conservative, it will be surgical. And anytime I am giving therapy where I am not doing any kind of an incision, then that is conservative. So the diseases can be treated in both mechanisms. The good medical practices suggest that we should strive as much as possible to manage any patient condition in a conservative manner, so that any complications which can arise, discomfort which can arise out of incisions, can be prevented. So depending upon the bodily systems, then you have different kinds of services available. I'm not going to go into the theories ki what is cardiovascular, what is neurological, what is neurosurgery, what is gynecops, what is ortho, what is uro, what is nephro, what is dermato. Because this is something which is available and which you can understand practically when you join the jobs, or even Google can assist you with these things. But what is important to understand here is, irrespective of the system, whatever issue is happening, whatever that unease is arising, we need to understand what is the cause for it. What is pathogenesis? So how has this developed over the period? Because that is something which will help you when you are going to take decisions or add judgment for claims which are coming to your bucket. So pathogenesis means the progression, development and happening of incidences or events in the body which do not happen in a normal course of time. So how it develops, how it progresses, how it proceeds further is important to understand. That is going to help us further to understand and control the kind of non-disclosures and non-disclosure related abuses or fraudulencies which generally are seen in the insurance industry. So, with this background, let us now move further towards kind of uh, things which are going to check when we get the claims in place. So, we'll again have the presentation loaded. Perfect. Hopefully it is seen to everyone. Perfect. So we have seen how to now decide whether a treatment, whether a commonly occurring disease is to be paid, and if to be paid, then how it is to be managed from an insurance perspective. So this is a small snake which developed when I was thinking about this. And the snake said, "Sir, please only make us remember 9 steps, and by remembering those 9 steps, we'll become the best adjudicators in India." So, what are those 9 steps? The 9 steps towards claims management, claims decision making, claims adjudication start with questioning each and every case. What is the need of hospitalization? So, what is the need of hospitalization? एडमिट होने की जरूरत क्या है? Why do I need to be in hospital? Can the issue, can the problem which is happening be not cured by not going to hospital? What is it that the hospital is going to add something which is not possible in an outpatient setup or at home? So the answer lies, provided you require continuous nursing monitoring, your condition is not stable, you suddenly deteriorate and there is a risk that you may further deteriorate, then you require medical supervision. It means you require hospitalization. There is a situation wherein you are not able to handle your day-to-day services properly, neither are relatives able to manage it. You require certain medications time to time. So you are in need of a nursing care, which is not possible in an outpatient service. You require hospitalization. You require certain medications which, if given, have a probability of complications, episodes happening as adverse reaction. You require hospitalization. You are in need of a surgery, then definitely you require hospitalization. You are in need of certain treatment which requires bigger equipment, bigger mechanics, which cannot be purchased at home. You require hospitalization. So, if none of this exists, then the need of hospitalization is not there, and it is OP to IP conversion which happens, and you need to take decisions accordingly. Second aspect, as soon as you talk of need of hospitalization, is what was the OP care plan given and what was the result. So what is care plan? Care plan basically is documentation of what you are going to do to the patient to help him come out of that dis-ease condition. So it could be either medications, it could be either any kind of supportive care, or it could be something like counseling also. So anything and everything that you do to help the person come out is a care plan. How you are going to be caring for the patient. So first you also need to understand what was the OP, outpatient care plan, and what was its effect, result. So if and only if your outpatient care plan has failed, then only you require an IP admission. So you have a history of fever, बुखार आ गया था sir. So have you taken paracetamol? Have you done your sponging properly? Have you taken rest? If yes, and still it is not cured, then you require further admission to evaluate what the condition is and give you IV treatment. So after understanding the failure of the OP care plan, what I need to understand is what is the planned care as an inpatient. So if it is only further investigation, then investigations can happen on an outpatient basis also. The blood can be taken by a phlebotomist at home also, in a clinic also. The reports can come. The sonographies can happen in a planned manner. The X-rays can happen. So if only investigation is the purpose for inpatient, then it is wrong. Planned care plan cannot be for investigation. Planned care plan has to be for the clinical interventions which will help relieve the difficulties and diseased condition of the patient. And the fourth aspect is that has to be supported with diagnostic evidence. So when I say pain in abdomen, severe pain in abdomen associated with vomiting, and I say appendicitis, say I want to do appendicectomy, I need not believe it. There has to be a diagnostic evidence associated with it. So because of vomiting, how has my electrolyte range got deranged? Because of my inflamed appendix, can that be seen in my sonography report? Can I see any burst, any issues on my standing X-ray report? Then that is supportive of yes, the diagnosis and the IP care plan being required. It then has to be checked for whether the execution, what was documented, is properly done as was planned. Because if the execution is not as was planned at the time of admission, then again the hospitalization is not necessary. The sixth aspect which comes out as we go through the documentation and understand the medical condition is what is the evidence of improvement. So how the patient condition has improved, which will be supported with diagnostic betterment findings in the reports, the nursing notes showing the improvement, and the doctor notes updating about the patient current status whenever he is going for rounds. The seventh aspect comes, how do I control the length of stay? LOS is length of stay. Because we saw in the audit finding, unnecessarily hospitalization, excess duration of stay, stay beyond necessity. So the moment my nursing notes decide that yes, the patient is in a proper condition, no further care is being given which cannot be given on an outpatient basis, the person is able to take medications orally, then the time has come for the patient to be discharged. And this, by the time you come out of your college, is going to become a standalone business opportunity in future, as India is now a ripe market to provide case management and care management services. So controlling on this length of stay, controlling on this execution of IP care plan, supporting the hospitals, supporting the insurance companies, both together is going to be something which will be a crux of care management services and case management services, which should be seeing the day of light by this year end or maybe next year end. And then what we look at the eighth aspect is whether the billing is as per the agreed tariff. Because finally this is all money. This money belongs to everyone. All the persons who have contributed and taken insurance policies. So the role comes here is to ensure that the billing is as per tariff. And then the ninth part to be understood is whether there is any exclusion for this kind of a treatment. So we have to decide there is non-exclusion and then this becomes payable. So any questions on this 9-step thing which you have to see for adjudication of claims? If no questions, we'll move to the next slide.
Sir, what was control LOS?
Length of stay. So I had fever, 100 degree Fahrenheit. I got hospitalized. because after someone had fever 100 degrees Fahrenheit, he got hospitalized because even after 3 days of oral paracetamol, dolo 650, he could not be coming out of it. So he had to be given IV Taxim, IV antibiotic medications, and blood culture to be done, which was showing septicemia. So he got admitted. So admission temperature is very high. He is being given IV antibiotics. He is being given IV paracetamol. After 2-3 days, as we see the temperature chart, we find that the temperature has now reached 98.3 degree Fahrenheit. But the course of IV antibiotics, which was prescribed, was for 5 days. He is still in hospital. So the hospital continues to keep the patient in inpatient. Fourth day also billing happens. Fifth day billing also happens. But ideally, after the patient is stabilized, the same antibiotic is available in an oral format. So IV is not required. The patient should have been discharged and asked to continue oral medications. This is one example of controlling on length of stay. Another would be wherein you would have had a surgery. Someone has had this heart attack. He has gone to the hospital. They have seen the ECG. They see that there is changes in the ECG. They say heart attack hai. Immediately angiography karo, angioplasty karo. So you are worried. You allow it to be done. Angiography shows there is a block. They allow it to be removed with the stent. But now, even after that, the patient has streamlined, but they keep the patient in ICU. After 2 days of ICU, they are shifting the patient to ward. And the patient is absolutely normal after the angioplastic procedure, but still they say patient ko rakho. He is under observation because you are giving him more money. So again, this is where you come into picture. You need not keep the patient. He is recovered. Statistics say 99.98% of the patients post angioplasty, 1 day of ICU stay, require only 1 day of normal monitoring and should be discharged after second day. And that is why the angioplasty packages, when they were created, only length of stay of 3 days was considered, 1 day in ICU and 2 days of ward. So again, that is where your control of length of stay comes into picture. The person has come to you with a block. There is only one block in the heart, but the hospital says bypass karna padega. Because the moment you are asking for the bypass, you know you will require 2 days because you are cutting the heart now. Right? You are cutting the chest to go to the heart. So there will be more nursing care required. So you will have extra number of days. Extra number of days means extra number of money. But that single block you should be treating with a stent. You don't require a bypass surgery there. So that medical expertise, that medical input coming in, artificial intelligence coming in the softwares which you people will be developing in future. No, not required. Go for angioplasty. So control of length of stay, case management. That is going to be the near future. Have I answered your query?
Yes.
Thank you very much. So
Sir,
let us, yes,
sir, I also add one more. Sir,
yes.
like insurance company, all of them conduct. I think the voice is repeating. Yeah, sir. So insurance conduct check at all the stages or directly at the time of when claim is asked by the.
Sir, can you disconnect audio from the other device? Then it will not echo.
There's no audio from the other device. Okay, is it clear now?
Yeah, yeah.
Yes.
Yes, sir. Sir, I wanted to ask. Sir, it is again repeat.
I think the issue is from your side.
No, Vagish. Sir, actually, you have joined from mobile also, right?
No, but it is from a different location, and up to now it was not echoing touchwood, if I'm not wrong.
Yes, yes.
Is it still echoing anywhere?
Sir, I think when I'm speaking, I'm hearing my voice again.
Okay, okay. So maybe can you mute? Yeah, is it echo happening?
So when you are speaking, then no echo is happening. But if
Yeah.
somebody else is speaking, then
Huh. Okay,
But
so can
Vagish, I did
you?
not hear echo when you spoke right now.
for you as well now, I didn't.
For me,
Yeah, yeah,
No,
now it
no,
is fine.
yeah,
Now it is
yeah,
fine.
you can ask him.
sir. So I had a doubt. So, sir, does insurance companies check at each and every stages, or at the time of claim settlement only they check all the documents, like all the procedures has been addressed or not, it has been correctly done or not? Is it like that, or at every each and every stage they check, sir?
Checks and balances are built into the systems right from the time the person intimates that there is a likelihood of a claim happening. So, what ideally good TPAs and good in-house health insurance companies are doing is they immediately do a telecalling and mystery calling to ensure that the person is really getting hospitalized, and there are specially trained doctors who speak to these patients, evaluate their condition medically, and they also direct the patient to a nearest healthcare provider who is in a proper condition to treat at a lower cost. So that is part A, that is when the immediate evaluation happens. Now after the patient is hospitalized, if he is going in for a cashless, then the request comes from the hospital and the documents get audited, documents get evaluated, adjudication is done by the pre-auth doctors. If it is a claim intimation, that is reimbursement, then there is a probability up to 20% of the cases that a doctor or anyone's field visit is triggered and the actual patient treatment is checked what he is taking in that particular facility. Then when the claim comes, whether it is cashless or reimbursement, everything is audited fully. Now, even before the claim coming into picture, before a policy is issued, from a risk rating perspective, medical documentations are asked for. So if you have disclosed any history of any disease or any surgical intervention or hospitalization, then even before the issuance of the policy, the medical documents are checked, and if a need is felt, fresh investigations are ordered from panel diagnostic centers, which comes under the purview of pre-insurance medical services. So it's complete checks and balances systems which exist across the globe. Certain countries are more advanced, like say Singapore or even US, where it is auto adjudication softwares which are developed. So the hospitals have to route everything in this matrix, and the matrix automatically takes a call what is to be paid and not to be paid. Even India since last 2 years is planning. I was a part of that committee of NHA where these discussions have taken place of coming out with a national digital health platform, NDHM, wherein it will function like a UPI platform. So hospital may have any software, the doctor may have any software, the insurance company can have any software, but just like I can make payment from HDFC to ICICI by using any of the UPI provider, be it Google Pay, be it Phone Pay, be it Paytm or anyone. Similarly, this NDHM platform will ensure seamless transmission of data. So that is something which will then further bring about more control and gated control mechanism of how healthcare functions in India. And that is something which I see happening by 2025 successfully. So then the control would be there even before the person decides that I want to take an insurance policy. Have I answered your query?
Yes, sir. Yes, sir.
Great. So any more questions before we now go into the depth of the diseases? Some common diseases. Great. So I'll again go back to the presentation slide. Just a second. Yeah. So after this 8-step mechanism, 9 step, let us now understand these commonly occurring diseases. So what I have done is I have selected around 8 conservative treatments which we need to understand properly and 7 surgical treatments. So in conservative treatments, the very first thing is, okay, one disclaimer after this lecture, kindly do not go and start treating patients as if you know everything. That is very important. So this is a disclaimer which I have to give you. So first thing is conservative treatments. So very first aspect which we need to understand is pyrexia. Pyrexia का मतलब होता है fever. So it comes from the Latin word pyrexium. So the moment your body temperature goes beyond a certain limit, you start getting ill effects. You start feeling diseased. And the body temperature is controlled by the body metabolism. So anything and everything which brings about an increase in the metabolic rate of the body creates higher temperature in the body and you have fever. The commonly occurring things, reasons for that which we have to be aware about is malaria and dengue, which are very common in India. Before the onset of COVID-19, in our medical schools, we used to tell persons, tell students and everyone, any person of fever, unless proved otherwise, has to be considered as that of malaria and treatment started with chloroquine. Because that is the extent of malaria prevalence in India that we have been having. But now with COVID-19, the new axiom is any person with malaria, with fever, and any of the complaints of the upper respiratory tract should be considered as COVID-19 and care initiated with diagnostic order. So the aspect that you need to understand about fevers is whether what is the cause of that fever. So it could be pathogens such as infections, I mean to say, which could be viruses, which could be parasites, or which could be bacteria. So whenever a person is coming with fever, the first intention is to document what is the cause of that fever, whether it is viral in nature, whether it is bacterial, or whether it is fungal, parasitical, because your medicines differ accordingly. Because you have to treat the root cause of fever. But for immediate relief, what is done is immediately you give certain medicines which reduce the temperature, which bring about a cooling effect in the form of sweating. So you would have observed, if you have had fever in your lifetime any time, the moment you have fever, you are very unwell, you take some paracetamol or something, after small time, you get sweating and the temperature falls down. That is how the fever gets controlled by these antipyretic medications generally. So that is my first line of treatment. Second is to reduce body temperature. What can additionally be done is, and ideally recommended is, sponging. कि भाई नमक की पानी की पट्टियां लगा दो. दादी जी used to tell us, right? Or Nani ji in certain cases. Very simple thing. So you are creating a temperature barrier. You are allowing a lower temperature aspect to be on the body, skin. So the heat transfer happens from the higher level to the lower level physics है, but we are seeing it in medicine. Normal physics, हाई टू लो ट्रांसफर हो जाएगा, हाई का टेम्परेचर कम हो जाएगा. ये आपका जो स्पॉन्जिंग का स्पॉन्ज है, अगेन यू पुट इट ऑन अ लोअर, you come back, you again sponge, it again goes off. Simple mechanism. If it is not being reduced with this simple treatment and more hydration, definitely बहुत सारा पानी पिलाना है, so that internally also you start getting that hydration. Then you now need to understand कि what is the source, what is the cause, and because depending upon that cause you are going to give him the medicines. See, if you feel that the symptoms are more of malaria in nature, malaria के symptoms मतलब क्या है? So you get fever which comes cyclically. All of a sudden you have chills, you shiver, and then there is sweating. Classical symptoms of malaria. So if this is something which is happening, and you have had a fight with mosquitoes any time in the previous 24 to 48 hours, ideally we should not have fight with mosquitoes, but sometimes it does happen, then it is considered as malaria in nature. So if you are a good clinician, based upon these and other physical findings, you will declare the patient as malaria, you will give him hydroxychloroquine to start with. Post food definitely 2 टैबलेट तुरंत दोगे, 1 टैबलेट 6 घंटे के बाद दोगे, 1 टैबलेट 24 आवर्स, 1 टैबलेट 48 आवर्स, and the person will be cured. But if you have doubt, you will order diagnostic tests in the form of peripheral smear or malaria antigen. If the symptoms are such wherein you have this body ache, especially bone ache काफी हो रहे हैं, and you start seeing those small minuscule patches on the body reddish, then it means it is dengue in presentation with a fight with mosquitoes in the preceding 24 to 48 hours. So you will like to confirm with a test. So you will go for NS1 antigen test, or you will directly go for the IgG and IgM bodies, antibodies. In either case, there is no medicine for dengue. What you do is you give supportive care, you monitor the hydration, you improve the immunity, you control the platelet count, and the patient feels better. Similarly, there are other fever panels available. So whether it is typhoid, whether it is chikungunya, whether it is this gunya, whether it is that gunya. So all that comes under fever panel. So if you order the fever panel test, the lab will give you the reports and you will understand what has happened. And accordingly, the medicine will be decided. And in spite of all these things, you don't know what is the source, then you declare the patient pyrexia of unknown origin. Now, why this is to be understood is generally fevers as such, specific fevers as such, especially malaria, typhoid, they are treatable even in government facilities. And so, in government health schemes, they are reserved for treatment in government facilities, and private hospitals are not allowed to treat them. But the private hospitals label these fevers as PUO because PUO treatment is allowed in private hospitals and they claim for it. And we as adjudicators, we are under stress, we forget the basics of PUO. That PUO can be labeled only if the other sources are found to be absent and we allow it to be paid, which is wrong. We become party to the abuse and the fraud by the hospitals. And that is why this basic understanding was important for fever. तो कल जाके यदि कोई आपके पास फीवर आता है तो what will you do first thing? Can someone tell me? If someone comes to you with fever, what will you do? Can someone please respond? Anyone?
Ask him to quarantine.
Good answer. Second thing, before quarantine, what would you ask him to do? To come out of the disease condition? नहीं सुना किसी ने?
Sir,
You have
we will give him the proper care plan. And sir, first thing that you told about um, using lukewarm water handkerchief treatment, sir. Other than that, we will also advise him for hospitalization if there is a need.
good. The answer should have been, sir, we will just ask him to meet a doctor because I have clearly given the disclaimer. After understanding this, you will not be working as doctors. So the answer should have been, sir, हम उसे डॉक्टर के पास भेजेंगे. See, we are taking this knowledge from
Right.
education perspective, not to treat. Self-treatment or treatment even for relatives with this incomplete knowledge is going to be more harmful. Okay? So after this break, let us move to the second aspect, which is respiratory tract infection. नहीं तो आप सोचोगे यार ये कौन सा रोड ट्रैफिक इंसिडेंट आ गया. No, it is respiratory tract infection. Neither is it Right to Information Act. It is respiratory tract infection. So anything which starts from my nose till my lungs is a respiratory tract. And any infection happening in this, my nose, my throat, my tracheas, my bronchuses, my lungs, is called as respiratory tract infection. So here commonest which we are seeing nowadays is COVID-19, and if someone comes, quarantine हो जा, डॉक्टर के पास जा. Second is pneumonias, wherein you have this consolidation which is happening in the lungs. Lungs का जो parenchyma है, lungs का जो matter है, वो solid हो जाता है. It cannot function properly, then it is pneumonia. Or it could be inflammation. जो मेरे pipes है bronchus के, वो inflame हो गए हैं, then it is bronchitis. Or another aspect of respiratory tract infection which is not infectious in origin but I have kept here is asthma. You have got certain allergy and you are not able to breathe properly, and so you require treatment. So what is to be remembered here is, in all such conditions, you will find the doctor's notes which will document the complaints as something is happening, something is abnormal, and the care plan will be suggested accordingly. So if it is an upper respiratory tract that is above my throat level, above my larynx level, then generally just by my physical examination I'll understand what is the source. So even my sinusitis is part of my RTI. And accordingly, based on the physical findings, appropriate mechanisms in the form of anti-inflammatory medications, antihistaminic medications, painkillers if there is pain, and antibiotics will be initiated to control the condition. Throat pain hai, pharyngitis hai, you may start immediately on any of the antibiotics, preferably, generally, ofloxacins are recommended. But आज की डेट में आपका एजिथ्रोमाइसिन चलता है. And so that is what has become the standard treatment nowadays. If you feel it could be viral in nature, they will not be giving any antibiotic. You will only be giving supportive care to reduce his sneezing, to reduce his running nose, to reduce the cough. So you will give antihistaminics and you may give any cough suppressants. And you will ask the patient to have proper breathing exercises. If it is a serious viral condition for which viral medications have been established to be curable, then you may like to establish the causative factor as a virus first and then have those medicines given. तो बर्ड फ्लू है, कंफर्म हो गया, you will have it and give the patient Fabiflu tablets, capsules. COVID-19 है, कंफर्म हो गया, patient is deteriorating, you will like to give him remdesivir. So that is how the treatment judgment is going to happen. 90% of your RTIs do not require hospitalization unless there is breathlessness and oxygen saturation of the patient is going down. Oxygen saturation matlab oxygen is not getting properly transported to your different parts of the body through your blood vessels. So then you require hospitalized care because you may like to push in more oxygen, you may like to relieve the breathlessness, and you may like to go to the causative factor. Otherwise, they are treatable. Next, we come into urinary tract infections, very commonly abused in insurance. Ideally, urinary tract infections are treatable on an outpatient basis, very easy to control, not at all difficult to treat with simple antibiotics, more of hydration, alkalinizers being given so that a proper salinity difference is created and the urinary infection is resolved over a period of time. But because you are an insured person, you may like the patient to be hospitalized and then you will give every antibiotics which are not required. You will keep the patient in hospital and start creating a lot of bill. So you have to be careful. Another aspect to remember about urinary tract infection is what is the commonest cause for it. So your urine as a medium becomes a source, a good material wherein bacteria can grow, organisms can grow. Then you get these infections, and one of the causative factors which brings about this improvement or brings about these better growth conditions is diabetes. So if your sugar levels are not in control, they get excreted in your urines and they become a rich source for the organisms to exist, and you start getting UTIs frequently in diabetic patients. And if diabetes is pre-existing, then they should not be paid by insurance. So this is how you correlate these diseases. The next we are talking about is age. I'm not asking your age, by the way. The age here stands for acute gastroenteritis. Acute मतलब suddenly हो गया है. Gastro मतलब जो मेरा gastric pipeline है, मेरा mouth, मेरा throat, मेरा esophagus, my stomach, then the duodenum, then the small intestine, then the large intestine, the colon, the rectum and out. तो ये जो मेरा पूरा gastric tract है. So anything about this gastric tract, enteritis. Now, enteritis is particularly about only my enterium. And what is my enterium? The intestines. So, itis is inflammation. So, inflammation of the intestines of the gastric tract, which happens acutely, suddenly, is labeled as acute gastroenteritis. या लेमन लैंग्वेज में डायरिया, लूज मोशंस हो गए, लूज मोशंस. ठीक है. So the elements such as these are important. Here what is important is because of this sudden attack by these pathogens, you have what I'll say motions happening very frequently. So you have electrolyte imbalance, you get dehydrated, your water levels are going down, and then there is a risk that because of this the normal functioning of the neurological and the cardiac muscles cannot happen. So you need to control this condition immediately, maintain the electrolyte balance, and in that case you require hospitalization. Otherwise what is required is simply you consume water with salt, because salt has sodium and chloride in it, which will take care of your electrolyte imbalances automatically. So first treatment is lot of hydration with salt water preferably, or ORS which is available commercially को purchase करके, and your AGs will be treated. If it is not being cured within a day or two, then you start to look out for what is the source for it, and accordingly you may start for medications with modern medicine, modern investigations, modern pharmacy coming in picture. Combination medicines are available which take care of bacterial as well as parasitic infections by a single tablet. So you would have found, if unfortunately someone in your relation or friend circle has suffered, they would have given something called as a Norflox TZ, Uflox OZ. तो उसमें वो पहला पार्ट होता है बैक्टीरिया को मारने वाला और दूसरा पार्ट होता है पैरासाइट को मारने वाला. So the doctors don't want to wait, they just want to give immediate relief to the patient, because then the patient will feel happy and he will keep on coming back again. But not a good medical practice. You first allow the body to recuperate on its own. If it fails, then the pharmacy should come into picture. And if it still fails, then go into diagnostic evidence, what is the cause, and you require hospitalization to prevent the complications. The fifth aspect is gastritis. So gastrum is your stomach and inflammation of the stomach is gastritis. तो यहाँ stomach का मतलब है internal layer endothelial lining. It happens generally because of excess of HCl secretion, acidity. That is something which happens on and off to most of us, but a situation may arise where it is so severe that you require IV medication to control it, because if it continues, then there is a chance that it can result into ulcers as well. Then you require hospitalization and then maybe further investigations in the form of gastroscopy, endoscopy, Atl. Stroke is basically your cerebrovascular accident. So somewhere in the brain, the vessel which is supplying the blood, वो decide करता है कि मुझे अभी टूटना है. So just like the water which is coming to your flat one day does not come because somewhere the pipeline has broken. So similarly here the vessel has got a break, so further part does not get the blood, no oxygen, no nutrition, and you start getting the effect all over the body, because the moment water does not come to your flat, you are not having a bath, you have not had your food, you go out and then the person starts suffering. So similarly यहाँ पे ब्रेन का फर्दर पार्ट को तकलीफ हो जाता है and you get your problems. Very simple to remember. There are other complications as well, complicated conditions also associated with stroke, not related to your blood vessels alone. So there could be neural damages, neural issues which can also cause strokes. नॉर्मल लैंग्वेज में इसको हम पैरालिसिस भी बोल सकते हैं कई कंडीशन में. MI stands for myocardial infarction. So myocardium is muscles of the heart. Myocardium, cardium is heart, and infarction मतलब मर जाना, टूट जाना. So just like the blood vessels in the brain not getting the nutrition, similarly it may happen that certain parts of your heart, they are not getting the blood because of blocks or something like that, or because the neural pathway is damaged, and then it will result into myocardial infarctions. So the very first thing which needs to be done here is immediately stabilize the patient. 99.9% of the times it is because of certain thrombus or certain block which has come and prevented the transfer of blood. So you give enzyme treatment, urokinase, streptokinase, immediately दे देते हैं, so that dissolve that thrombus if it is there anywhere, and the blood supply is restored and the patient feels better. If too much of damage, then you may like to give inotropic agents. Inotropic agents मतलब जो agents हार्ट के फंक्शनिंग को बढ़ाएंगे and control the patient condition, and then further you like to go for diagnostic evidence. MI के लिए OP treatment नहीं है, it is an emergency. Stroke के लिए भी OP treatment नहीं है, it is an emergency. And then सोनो USG करके 2D echo करके you will find what is the positive factor and then further take the surgical steps required if necessary. Chemotherapy is medical treatment of your cancers. So cancer, your oncology. Oncology is a subject which studies all the oncos. Oncos is cancers. So any growth which is abnormally happening in the body of any tissue, that is cancer. If this growth is going to be limited to a particular location and is not creating any complication, it is not spreading further, then it is benign, and if it is spreading, then it is cancer, yeah, malignancy. So medicines which help in preventing this automatic growth happening in the body are termed as chemotherapies, chemical therapies. That is how the word chemotherapy has come into practice. So if it is a oral chemotherapeutic agents, though it is costly and no side effects documented, adverse drug reactions documented, then ideally they should be taken at home. You do not require hospitalization. But 90% of the medications are IV medications where you can have reactions, and for that you require to be under medical supervision, not hospitalization, under medical supervision for that particular acute period of infusion. And that is why you will find that chemotherapies are given on a daycare basis and they are payable under insurance as well. So if you have confidence that it is not fraudulent documentation, then you should have empathy for the patient and pass the claim at the earliest. That is a humble request whenever you get into actual services. So irrespective of whatever comes here, for all these cases, what you would be looking for is 6 things: need of hospitalization, care plan, diagnostic evidence for that care plan, whether the execution is as per care plan, monitor that there is no extra length of stay, and ensure the billing is proper. And that is how you manage your commonly occurring conservative diseases. कंजर्वेटिव पे कोई डाउट है तो पूछ लीजिए. Any questions regarding conservatives before we go into surgicals? If there are no questions, it means either you are not listening or either there are no doubts. Okay, great. Any questions? Okay.
No, sir.
So, great. So let us now go into the surgical cases. Now I have considered very typical and simple surgical cases in this introductory session. Cataract, wherein over the age, as age grows, the lens fibrosis happens, it becomes thickened, and you are not able to have the rays pass through, light rays pass through it properly and concentrate on the proper location in the eye. So that is cataract. So it is age related, and that is why that you will find that this has got a waiting period of 2 years in most of the policies, unless it is a group policy, because you cannot prove it to be pre-existing or not pre-existing unless you have taken photograph and then an evaluation of the patient. So waiting period is prescribed. Treatment, many people say conservative, ye drop dalo, wo drop dalo, but nothing proven scientifically as of now. Treatment of choice, which takes hardly 5 minutes, is extraction of the lens. Second treatment of choice is replacement of the lens with an artificial lens, and everything gets settled. Not more than 5 minutes. It's a very safe surgery nowadays. Over the years, camps have been arranged for cataract surgeries in rural areas, even in urban areas, and cataracts are done. Since it is easy procedure, hardly any complications, nearly daycare in nature, this was one of the first procedures to have packaged billing in India. It started right in the year 2004 itself. Yes, I remember. So at that time it was TTK Healthcare Services as a TPI, which now today is Vidal Healthcare. So they had come out with compulsory cataract packaging for all the hospitals under their network, and that was then taken up by all the other TPIs, and then the insurance companies modified their policies in 2005, and limits started coming in for cataract. So such initiatives are expected to be taken by new people when you come into the leadership position, do analytics and understand what all things can be packaged for control of abuse. Otherwise, you would have found that there were doctors who were charging 1,80,000 irrespective of what the cataract is like. Simple disease. Abuse happens only when the lens type changes. Certain lenses are there which are cosmetic in nature, because by use of those lenses you won't require the glasses. But then insurance does not pay for cosmetics, and so then those lenses are not payable. Otherwise everything is easy, packaged, fixed costing, sublimited ailment and payable. TKR is total knee replacement, THR is total hip replacement. बहुत commonly occurring conditions है, both are related to arthritis, age related changes. Generally in 90% of the cases, 99% of the cases I'll say, 1% of the cases there could be traumatic cause as a factor for TKR or THR being recommended. So since they are again age related, again they have a waiting period of 2 years generally in most of the insurance policies. Some policies plans they have 1 year waiting period. So here you first need to establish the necessity of the TKR. So whether the conservative management has failed drastically, whether the pain is not relieved, whether the gait has not improved with conservative treatment, with physiotherapy, and supported with radiological evidence that yes, it has deteriorated to such a large extent that your angles are deviated. So your scanogram suggests the angle becoming obtuse in nature as compared to the acute angle which is expected. And then you know, yes, the time has come wherein the knee has to be replaced or the hip has to be replaced. What is important to remember here is the radiologic evidence before surgery and after surgery. When you are doing these replacements, there are many different varieties of implants available, cemented, uncemented, and then depending on the implant material, you can have biologic, you can have titanium, you can have oxynium, you can have metallic, you can have non-metallic, and number of varieties. So they are the only things which will differentiate the costing. But as I said at the start, we are greedy. So doctors and hospitals have come out with a mechanism. We are doing punch hole knee surgery. We are going ahead with robotic knee surgery. So we are using robotic arms. So they will bring out certain conditions which will add up to the billing. So we have to be careful whether that has actually been used or not and ask relevant evidences for the same. Third would be fractures. So anything which breaks the continuity of the bone is called as a fracture. Touch wood, none of you should have suffered from it, but if you have suffered, you have more experience than what I can teach you about fractures. You need X-ray evidence. The primary line of treatment is immobilization. Immediately उसका movement बंद कर दो उस टूटे हुए bone का. So that can be in the form of either strapping या plastering. If it is a serious bigger fracture, then you may have to reduce it under the supervision, anesthesia वगैरह देके. If it is a larger fracture, complex fractures, then you may have to use implants in the form of say K-wire or any other implants, external implants or internal implants which are available to allow that to recuperate. और यदि कोई use किया है implant, तो then you will be removing that implant after a certain period of time. Evidence before surgery, after surgery, you should be able to see the change and the implant. And if the implant is used, then you require the sticker to determine what was the cost and whether that implant is actually done or not. PTCA CABG हमने शायद पहले वाले discussion में already we have taken and we are already running over time, so I am not going to touch it right now. Maybe in future classes we will go into details when we go into systemic examination, systemic discussions. Hysterectomy is removal of uterus, a commonly abused procedure. Unnecessarily, uteruses have been removed in the past, and even now in certain hospitals, certain locations, you find it happening. So there has to be an established reason why it has to be removed. Failure of all other treatment modalities, growth which is there, which is going to be dangerous in nature for the lady, and family size being completed, then only uterus removal is recommended, otherwise not. Here also depending upon the modality कि आप कैसे निकालने वाले हो, एब्डोमेन काट के निकालोगे या लैप्रोस्कोप डाल के निकालोगे या ट्रांसवाजाइनल करोगे, यूटरस के साथ for all parts you will be removing, you will have multiple different surgery grades coming in and billing happening. So for anything which is removed out of the body, you always require a removed part histopathology examination report as evidence that it has been removed, and then only it gets paid. Septoplasty, it's your nose surgery. So again, this is something which cannot be proven to be pre-existing in nature generally unless you have the photo evidence to prove it. So it also has again a waiting period. What additionally happens with that is your functional endoscopic sinus surgery space. Simple surgeries है, day care है, you require an evidence in the form of diagnostic findings, x-rays, water view वगैरह लेके to prove that yes, it is required, and then post surgery again x-ray to prove that it is done. Appendicectomy, cholecystectomy, they are done in case of inflammation, appendicitis, cholecystitis, or any oncologic growth happening there or nearby. So you will have evidences before surgery and post surgery. You will be asking for the histopathology examination report on the removed part. So irrespective of all these commonly occurring surgeries, what is important to remember is only three things: diagnostic evidence for the necessity. Second is OT notes capturing the steps of the surgery. And third is operative evidence in the form of histopathology examination reports if any part is removed, or radiological reports if there is any change or improvement. So this was about the commonly occurring diseases. We have already touched 1.5 hours, which was our scheduled time for this first session. If you have any questions, let us take them, because I had also planned to discuss about dialysis, but I think that we can skip for the day. That will take care in future. So let us use the remaining 5 minutes or 7 minutes that we have for question answer session. So can you please ask questions if you have any?
Sir,
Yes.
like for example, a person needs to consult, and it is a surgical thing, but it can be done by daycare also. So will that
Yes.
be covered in the insurance policy? Like all the frequent visits and consulting, which is there.
Okay. Now insurance plans are different in nature. Generally, what is paid or what is available commercially in India is hospitalization policies. So your outpatient care, outpatient treatments are not part of it unless the hospitalization was required. If your hospitalization was required and payable under insurance, then you have pre-hospitalization expenses and post-hospitalization expenses, which are paid even on the OP basis. So different plans have got different duration: 30 days, 60 days, 60 days, 60 days, 60 days, 90 days. And in fact, I came across one new plan from Niva Bupa where it is 90 days before and 180 days after discharge.
Yes, yes, correct.
So all such permutation combinations available. In addition to that, now certain insurers have come out with outpatient plans separately. So outpatient insurance covers have come up. Around a week ago, I was having discussions with on this platform only with your institute, through your institute only. So Niti Aayog is also coming out with a certain plan, and they have been taking feedbacks through your institute on how that OP services can be done. So cashless OP services is something where MD India has an expertise in. We are a leading TPA in India, and we have shown that we have this network of doctors where we do provide cashless services. So outpatient is not only consultations but also your pharmacy expenses, your diagnostic expenses, and all those can be handled successfully through the technological advancement which is available in our organization. So that is something which is under discussion, and those plans will come out. Private insurers have come out with plans with coverages of say 500 rupees, 2000 rupees, 5000 rupees. But what makes these plans not what I'll say uh, highly utilized today is the pricing, because the volume base is low who want to subscribe to it, and the adjudication and the administration of these claims is tedious. So the premium being taken for them are nearly 80 to 85% of the sum insured cover. And so they are not very popular as of now. But yes, the moment it is auto adjudication in place, machine learning in place, artificial intelligence is utilized, complete cashless services, the backbone of which is ready with MD India is implemented, then the premiums can come down to as low as 20%, and then these plans will become popular in future. As of today, if you are having an insurance, 90% chance it is not covered if you just come to me for treatment in my clinic. Have I answered your question?
Yes, sir.
Any more questions? Okay, great. So let us take 5-minute break before we start our next discussion, which is on the role of TPN. Because that is something which you people need to understand. So you want to take a break for 5 minutes, or we want to continue immediately?